Hey everybody, welcome back to Summit Healthcare Education. Today we're going to be doing something just a little bit different. In front of me you might notice something that looks a little bit odd. This is actually a pig heart and lung set that we got from a butcher in the local area. So we want to kind of do an anatomy rundown for you guys to see what this looks like. Now, there are a couple of differences. Obviously, pig to human were not exactly the same, but this is pretty close. The most notable before we get there, and I'll point it out as we get a little further along, is what we call the pig lung or pig lobe. They have an additional lobe in their lungs that we don't have. So if you see some random piece inflating when we get to that point, like I said, I'll clarify. That's the most inaccurate thing I've seen here, or I can give you. But looking at this now from our top-down shot, you can see here, this is going to be the anterior view. Now, we don't sit quite the same, but fairly close, like I said. So we have our heart covered by the pericardium here. We have the lobes, so this will be the lower lobes. We have the upper lobes of the lungs. So those are going to be what we actually talk about when we get things inflated, when we breathe, when we talk about perfusion, ABC stuff. Okay, so without further ado, let's get into it. So, like I said, pig lungs, still illegal to get human anatomy. Grave digging is still frowned upon, illegal in most states. If you're from a state that still takes them, leave it in the comments. But looking ahead, so from the top down right here, we can see two immediate tubes. This first one, the more rigid tube, that's going to be our trachea, or the pig's trachea there. That is going to sit more anterior, or more towards the front. The smaller tube that is a little bit more pliable is going to be the esophagus, right? So this is the food tube. This is what will go down into the stomach organ itself, which I took a quick cross section of it. Kind of looks like this, right? A little pliable, a little spongy, still fibrous, still a tube, okay? So working our way down, let's start with the lungs. Now I have some equipment over here. I have an 8.0 ET tube that we are going to insert into the trachea to simulate breaths, right? So we want to see what these will look like when we talk about lung expansion. And I have a BVM here. Failure of equipment, my fault. Okay, here we go. I have a BVM here so that we can see that lung expansion. Now, one thing about this BVM, and we'll talk about it, and we've already made a video, we're going to talk about PEEP as well. PEEP being positive end expiratory pressure. If you're curious about PEEP, we have a whole video on it called What the Heck is PEEP? I'll give you a moment to check that out. Okay, now that we've looked at that video, let's get into the next one. So, like I said, I have my ET tube here, and I'm actually going to flip this so you can see a better view of the lungs. So now we'll be looking at the posterior view. This is where that pig lobe or pig lung lives, okay? So once again, we're looking at the esophagus on this side. We'll go ahead and let's give our lungs some inflation here. So, kind of giving some breaths, you can see here, right, that we have the lungs are expanding with each breath that I'm squeezing. Now you may notice that there are some spots that look like weak points. Those are what are known as blebs. Important to note, that's actually when we talk about spontaneous pneumothoraxes, if you're curious about that, or thoraces. If you're curious about that, check out one of our lecture videos. But that is a weak point in the lungs. Now, one thing that I also want to draw back to is that PEEP. I currently have the PEEP set pretty high, 20 centimeters of water. I want you to notice and remember with PEEP that the whole point is to avoid that first big hard inhalation or exhalation, right? It's the first blow into a balloon mentality. That's the toughest one to get. So by implementing high levels of PEEP, we can actually help to keep the lungs open. Notice how they're still nice and inflated here, right? Now if I lower this PEEP, you can see that the lungs will actually start to lose some of their inflation level as we progress. It's a minor change. I can see it on my side. This lung is a little bit quicker with it, right? I really inflated this guy up. But it's easier for those lungs to deflate without that PEEP. So remember, PEEP is important. It's there to help you keep oxygenation high so we can keep lungs inflated well, okay? Now I'm gonna come back to the lungs here in a little bit, but we're gonna move into the heart at this point. Okay, so I'm gonna disconnect. As you can see, my lungs at that point are going to shrivel down. We are not filling them up with oxygen. But let's give another little flip here. Whoop. Okay. So, like I was saying with the heart here, so around the heart, we have what's called the pericardial sac. Now, you guys obviously can't touch and feel or smell this organ set, but this is a very tough fibrous layer. Now, when we talk about things like pericardial tamponade, this sac that surrounds the heart is what starts to inflate with blood, fluid, whatever it is, depending on the circumstance, that puts that pressure down. And it's important to note how thick and strong this is, because our heart is now combating against tissue that's designed to keep it safe, right? It's made, or it's developed that way. So unfortunately, because we got this from a butcher, we are kind of limited by what we can get. This heart, unfortunately, was cut open, but there are some upsides to that, and we'll get to that. So moving away our pericardial sac, we can see the heart itself. Now, this is how the heart's usually going to sit. You can tell the atria because we have these little dog ears up here. Okay, so this is going to be the top. So our from patient's right to left, patient's right atria, patient's left atria. The left ventricle is this big meaty section here. You got to make sure that's the strongest because that's the one that's going to be pushing the most blood forward through the body. Now, if I flip it, hopefully you guys can get a good view from the top down. They actually cut into that lateral side here, and you can actually look into it and you can see these chambers. So right here, we have the atria. Right here, it's been cut open, we have the right ventricle. Now, a neat thing, and I'll cut this heart off so you guys can get a closer view of this as well. Neat thing is that you can actually see the valve chordae, or the connecting points of what separates the atria from the ventricle, that valve that allows blood to pass through. Okay, so like I was saying, we are kind of limited with what we've got, but this right here is going to be that right atria. This is going to be the left ventricle, or excuse me, right ventricle. Now, if I cut into the left ventricle, we may as well just kind of make it even here. Whoop, didn't go deep enough. That's my mistake. Cut into this left ventricle, you can see the cavity starting to develop there as well, right? So that's going to be the left ventricle. And then the left atria cut just below the dog ear. One more. Don't cut your fingers, Wade. That's bad luck. Okay. So we can see the left atria here. So this hole right here is going to be the left atria. And like I said, I'm going to cut this heart off and I'll show you from the top down camera a little better. We have the left atria, the left ventricle, the right ventricle, and the right atria. Okay. So let's just get this guy separated. So I'm going to start by cutting off this pericardial sac. Make sure I'm not cutting into the heart too bad. Okay. Pericardial sac removed. Now let's talk about this. So this is actually a great view of the aorta and the vena cava as well. So the vena cava is a little bit, I don't want to say spongier, but it's a little softer, right? Remember, veins and arteries are different. Arteries are rubberized. They hold their structure a lot better, right? Because we want to keep that constant flow. Veins are kind of like fire hoses, or just hoses, well, fire hoses, I'll say. They are going to be flat until there's fluid in them, which is why you know, above the EMT basic scope, if you're looking for IVs on somebody who is maybe hypovolemic or hypotensive even, you might have a hard time finding IVs because those veins are going to collapse with the lack of pressure in there. So let me get these cut. Don't cut my tube. Okay. Okay, so like I was saying, we have the aorta and the vena cava here. Obviously, we don't have that follow through. Once again, we're limited by the butcher. But you can see, right, we have our major openings. These are going to be our major vessels, or the great vessels. This is what's going to allow blood to be ejected and returned to the heart, vena cava, and aorta. So up close, right, we have the right atrium here, right atrium, right ventricle here, with the right atria continuing there. In this hole here, we have the left atria, okay? It's going to be the space there. And then our our left ventricle is going to be this space right in here, okay? That's essentially our heart. It functions very much the same. Top down, atria, ventricle. Atria fills the ventricles, ventricles fills the body, okay? And so that's the way that will typically work. Now, let's come back to our lungs here. Whoop, flip them over. So once again, posterior view, that's why you're seeing the esophagus here, not just the atria. So we talked about lungs, and we talked about PEEP, right? So once again, just as a reminder, as I give breaths, we can see these lungs start to inflate, okay? So this right here, this is a bleb. This one big bubble right there. That's a weak point in that tissue. That is something that could potentially open up for spontaneous pneumothoraxes or thoraces down the road. I believe with pigs, this is not an uncommon finding. With humans, this is not a normal thing. We should not be having these blebs. Okay, so inflate, I'm taking my breaths, high PEEP, so I'm keeping them inflated. If I take this off as a strong exhale, you see our lungs start to shrink down. Okay, now, once again, to emphasize the importance of PEEP, notice how much quicker these lungs will deflate in comparison to when we have high levels of PEEP. Notice that they are really rising and shrinking quickly. Okay, once again, going back, I want you to see it. Pardon my reach there. We can see it's holding that inflation level much, much, much better, okay? So, one thing I also would like to do, let's take this and we're actually gonna cut the lung here now, the whole thing. So in this shot here, you can see that these are actually the bronchioles. And notice that the lung is not like every diagram you've ever seen where it's a big hollow thing with these little tree branches in there. It's a fairly spongy set of material or set of tissue here. But the cool thing is that to highlight the importance of these bronchioles is that we can actually inflate them individually. If I just insert here, and I don't need to worry about this anymore, silly Wade. Come on, okay. If I inflate here, we can actually see this tissue start to expand itself. Oop, looks like we hit one that is not quite open all the way. Let's try this one. There we go. So you can see, and I'll just slide my organs over. You can see I still have that high level of PEEP, so it's holding itself open, right? But those bronchioles, these are just a couple of examples of them. There are many, many of them in there, okay? Because obviously we want to make sure that we have enough branches to fully inflate the lung at this point, okay? So notice I have that inflation. I don't have just my hollow, empty lung. If I take my breaths away, we have the tissue start to flatten back out. Okay, so we have the expansion of the lungs. When we see that big breath, we know, or excuse me, with a patient, we see bilateral chest rise. We know we're getting both lungs expanding at the same time. Same thing when we have that bilateral chest fall, we know that we are giving or having good exhalation from our patient. And then in real world with patients, this is where we could use things like CO2 monitoring to make sure that they're exchanging well. Because remember, everything in this field always comes back to perfusion, right? Big fancy P word. So once again, show you just that nice inflation here as we grip our breaths with high PEEP. And then once we take our breaths away, we have immediate lung closing. So remember, lungs are not muscled organs. They're not like the heart where it needs to contract all the time. We actually need this to be pliable and elastic. Now, pigs and humans, once again, a big difference is depending on what pigs are fed can actually change the colors of their organs. I can't remember which one. One is corn-fed, one is grass-fed. I cannot remember the difference. I do know, though, depending on what they're fed, they'll have a darker spot. So this is kind of more of like what your smoker's lung will look like. Now, another thing that you can see is you can actually see the vasculature lines in the lung as well, right? That's more than just stretch marks, for lack of a better description, because our lungs, like any other organ, they need to be perfused with blood. They need to have that oxygen exchange, but to keep the organ itself alive, it needs its own supply, okay? So working our way back, you can really see that bleb now, that really weak point in the lung there. It looks like an extra bubble. That's something where our spontaneous pneumos run the risk. Okay, so another thing, looking at our heart, kind of backtracking over. So once again, we have our, right side, left side, is you can see the vasculature running through the heart, right? So when we talk about things like MI, that's what we're worried about. We're getting blood clots in vasculature that are stopping that perfusion line from occurring, or that perfusion cycle from occurring to the heart itself. So then we start running into things, like I said, MI, leading into potentially cardiogenic shock, depending on how long it's been going on, with obviously the worst case scenario being cardiac arrest. Okay. Now this vasculature runs in many different places, right? We have the left anterior, we have a circumflex, which is the one running around, and then we have our posterior as well. Okay. All right, so this is just a good moment. Let's take it to look at this esophagus, right? So once again, easier to see. I have my little segment here, but you can see where this would go all the way down and see how spongy that is comparatively to our trachea, which is rigid, right? We want the trachea to be rigid, cartilaginous rings running around that trachea, help to keep it solid. Now there is going to be a weak spot, usually in the back, because that's going to be more protected, right? It's going to be the posterior side of the trachea. We're worried about the frontal assault, for lack of a better description, that anterior view, as averse to that posterior where it's up against the esophagus. It's a little bit better protected, and you can feel, it's hard to see this here, but you can feel the difference between that ridge here and that soft spot here. Okay. So that's realistically what our lungs and our heart look like. They function very similarly. Remember, atria contracts to ventricle, to the body, okay? And then remember, that's still circulating to the lungs for that oxygenation via the pulmonary arteries. Arteries are always away from the heart, veins are always towards. So that when during that heartbeat cycle, we have blood being sent to the lungs, reoxygenated, and then returned to the heart via the pulmonary veins. And that's going to be where, which you can kind of see those pulmonary veins or the remnants of them hanging off here. That's going to be what supplies that oxygenated blood to the left atria, to the left ventricle to contract through our aorta. Okay, so that's realistically what our lungs function like. That is something, or the way our heart functions as well, and it's a fairly similar view. I think you can get a lot out of looking at the anatomy of different animals, especially when, obviously can't get human stuff, allegedly. But looking at this, right, we can understand the inflation, and I think the biggest takeaway is the diagrams are great, but they can be misleading. This is not a hollow organ. It's going to stay spongy. So that's all I have for you guys today. Have any questions, make sure you leave a comment for us, and as always, be sure to like, subscribe, and we'll see you next time.